Hey, it's Dr. Broom. I'm back with another exercise demonstration video. Today we're going to move down to focus on the hips. I'm going to show one of my personal favorite hip rehab exercises and just movements, a way to move the hip and the pelvis. We'll talk about why it's beneficial and then some scaling options and some progression options for it. So the hip exercise that we're going to be doing is called the hip airplane. And the main principle behind this, and why it's very, very effective at helping with glute control, general hip pain, piriformis syndrome, sometimes sciatica stuff. I mean, these are kind of generalizations, but a lot of these things I typically either use it initially or progress patients towards this with anything around that. SI joint pain, very common for that. So, but the reason why it works so well is because our normal motions of how we use our hip is what we call open chain movements. So an open chain movement is whenever we take our joint and we move it around, okay, with it not fixed onto something. So right now my left leg would be fixed onto the ground. I cannot move my hip joint, all right? I have to move either my hips or my torso around my hip joint. But if my leg's in the air, well, now I can swing my leg around and I can move my hip joint because it's in the air. So that would be open chain. When my leg is on the ground and I have to move around my hip, that's a closed chain movement. So this particular exercise, the hip airplane, is a closed chain movement where we're going to take the hip, put it in a position where it's very stable. We're going to incorporate the foot and some knee control into it. And we're going to take the pelvis and we're going to rotate the pelvis around the hip joint. So the hip ball and socket joint kind of looks like a glove and a ball going into the glove, and it fits just like that. Everybody's hip socket looks a little different. Some people's are shallow and some people's have a little more depth to it. But nonetheless, this rotation that we're going to do with the hip and the pelvis, you should be able to accomplish it with some range of motion. You may feel some stretch on the back of the hip, but you really should feel your hip musculature pretty much on the back of your butt working really hard to control the movement. So without further ado, our setup. I'm going to have one foot kind of staggered in front, the other one behind, and I'm going to put most of my weight onto the front leg. So maybe 80-20 or 90-10 as far as weight distribution goes. I've got a little bit of bend in the knee here. I don't want to be locked out, and you shouldn't be down into a squat here. So slight knee bend. My kneecap is kind of pointed right towards my second and third toe. I do not want the knee to be rotated in here, and it doesn't need to be excessively rotated out like this either. So I'm here set up. My torso here, I'm not up tall. I'm leaned or hinged over, okay? And this is where I start at. So to get to this motion, a really important thing has to happen, and that is the hip hinge. So my knees, my hips, my feet, they all stay fixed in the same position. They're not moving. I'm taking my hips, thinking about like my back pockets right here, taking and pushing those back pockets straight towards the wall behind me while keeping my spine neutral. That right there is a hip hinge. Very important movement pattern for hip stability and low back control. But I'm here, start of my hip airplane. Your hands can be out to the side for balance support, or if you need to put your hand on a chair or wall or something, you can do that. Right here at the pelvis and right here at my shoulders is where my focus points are. I want them to move together. I don't want my shoulders to go any further than what my hips are allowing me to get, or what my pelvis is allowing me to get to. So hips are going to slowly start to rotate down as my knee stays still. Like I said, I'm going to get as far as my hips will let me rotate, and I'm going to slowly work my way back and try and rotate the opposite way to where now my chest, my belly is turning to face towards this wall over here, almost kind of towards the camera. My back foot is just kind of pivoting with me. I'm keeping my knee in the same spot, and I'm slowly rolling back into it, rolling the other way, and slowly opening up, rolling open. This is the movement of the hip airplane, okay? That very controlled pelvis movement rotating on top of a closed chain or a fixed hip on the ground. My foot is working really hard at staying stable, pushing into the ground. I'm kind of squeezing my arch up a little bit as if I'm trying to get the arch of my foot away from a thumbtack on the ground, if you want to imagine that. Key emphasis on my knee movement. I pointed it out as I was going, but as I twisted down, I didn't let my knee rotate with me and go out. And as I rotated up and away, I didn't let my knee come with me as I rotated away. We don't want that. Knee stays still in that same position where we started, right? Pointing towards second and third toe. So let me do one more demonstration with me facing the camera here so you can see it. I'm here, torso's leaned over. The further that I get my torso over, or if I pick up the back leg, now I've got more weight on this leg, more balance needed on this leg. That's going to make it more challenging. Hips rotate down. Shoulders just come along as long as my hips will let me. I don't need to rotate any further. I get to here, and then I'm opening up. Knee stays still. Torso goes and faces towards the other wall here, and then I rotate back down. And I'm making these muscles on the backside of my hip here, my glutes, control all of that rotation and stabilize me to where I'm very smooth moving through that rotation. So that is a demonstration of the hip airplane. You can adjust your stance for the stagger to make it easier. Like I said, the further that you lean over makes it harder. You can add in support, holding on to something to make it easier. You can get up next to a wall to help you rotate. If you progressed it further, you could add weight to one arm as you're rotating. That would make it a little bit more challenging. Or if you made your surface more unstable, balance pad, Bosu ball, or anything of that nature, slack line, those things would make it more challenging. So that's the hip airplane for hip stability, hip control, relieving low back pain that's coming from having weak glutes, weak hips. Give that a try. Let me know what you think. Be sure and like and subscribe, and thanks for listening.